everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Methotrimeprazine. Its brand name is Nozinan. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Methotrimeprazine is classified as a phenothiazine, and its sites of action are thought to be in the thalamus, hypothalamus, reticular, and limbic systems. It produces suppression of sensory impulses. This results in sedation, an elevated pain threshold, as well as the induction of amnesia. This medication also has antihistamine, anticholinergic, as well as anti-epinephrine effects. In terms of indications for use, Methotrimeprazine can be used for moderate to severe pain in non-ambulatory patients. It's indicated to be used for analgesia as well as sedation in situations where respiratory depression must be avoided. It can be used as a pre-anesthetic medication to produce somnolence, sedation, and relief of apprehension or anxiety. And some patients with psychotic disorders use this medication to sleep on an as-needed basis. Now, before somebody was to use Methotrimeprazine, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication will be contraindicated in patients who have a phenothiazine hypersensitivity. This medication cannot be used during an overdose of CNS depressants, and it wouldn't be able to be given to patients who are in a comatose state. This medication cannot be given with monoamine oxidase inhibitors, and it would also be contraindicated in patients who have severe hepatic disease. And lastly, for precautions, it cannot be given to patients who have blood dyscrasias. Now, in terms of precautions, this medication should be used cautiously in patients who have hypotension or low blood pressure. Patients with severe heart disease or severe renal disease should also use this medication very cautiously. And lastly, this patient must be administered cautiously with atropine, succinylcholine, as well as scopolamine. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they use or are to be given Methotrimeprazine or Nozinan, they can expect to receive their dose through an intramuscular injection, or depending on what country you're watching from, it can also be given in oral tablet form. The usual oral dose of Methotrimeprazine would be 25 to 50 milligrams per day, given in 3 or 4 divided doses. When the intramuscular injection is used for acute pain, typically 10 or 20 milligrams may be given every 4 to 6 hours. The dose would be a little bit lower for post-operative pain relief. It would be given at a dose of 2.5 to 7.5 milligrams. When the medication is used for its antipsychotic effects, you may see doses as high as 50 to 200 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Methotrimeprazine, so I'll go over some of those here now. Orthostatic hypotension, which is a sudden drop in blood pressure when going from a seated to a standing position, may occur with the use of this medication. This may produce fainting, dizziness, as well as weakness. A decrease in systolic as well as diastolic blood pressure has occurred. Systemic lupus erythematosus has been reported with the use of this medication. Rarely, confusion or disorientation may occur. Some patients experience sedation. And lastly, other patients experience dry mouth. That's all we're going to talk about today with Methotrimeprazine or Nozinan. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.